I'm Dr. Erin O'Brien, one of the rhinologists and ENT doctors at Mayo Clinic Rochester. Loss of smell is a common symptom with coronavirus or COVID-19 infections. While many people report that their smell returns within a few weeks, some people are reporting ongoing smell loss weeks or months after the infection. We know that loss of smell is a safety issue and it can affect quality of life. Someone who loses their smell may not be able to tell if there's smoke in their house from a fire or something burning in the kitchen. They may not be able to tell if there's a gas leak, natural gas or propane leak in their house. When someone has lost their sense of smell, food may lose its flavor. And people who lose their smell may report feeling sad, depressed, or anxious. It's important if you've lost your sense of smell to make sure that your smoke detectors are working. And if you have propane or natural gas in your home, get a propane or gas leak detector, which is different than a carbon monoxide detector. Fortunately, we know that smell can return after a viral infection. There are studies that show that practicing smelling can help the smell return more quickly. Olfactory retraining or practicing smelling involves smelling 4 different odors twice a day. The odors that we recommend are floral, like rose, citrus, like lemon, eucalyptus, and clove. You can practice with things around your house or you can get essential oils. The technique we recommend is smelling each odor for 15 seconds with a deep inhale through the nose. Wait 10 seconds, and then smell the next one. Again, 15 seconds of smelling, wait for 10 seconds. If you do this twice a day for a few months, you may be able to improve your sense of smell with practice. Again, if you've lost your sense of smell after COVID, make sure you have smoke detectors and a gas leak detector, and practicing smelling can help it return more quickly.